talking about minimally invasive surgery, typically you want to get a patient out of the hospital sooner. You want the patient to have the same outcome that they would have as an open procedure, and you also want them to have not only a better experience, but less narcotic use, less pain medication use, and the ability to get up and move quicker than they would with an open procedure. Typically, our incisions are no bigger than the tip of my pinky. When you do that, you are splitting the muscles as opposed to cutting the muscles. Therefore, you do not need the narcotic requirement that you would if you had an incision that was this long. What I can explain to some patients as they come in, we do a multitude of different cancer operations. We do radical prostatectomies, we do partial nephrectomies, we do nephrectomies, we do cystectomies, that's removal of the bladder. And to give you an idea, a typical patient that has a partial nephrectomy or nephrectomy has an incision that would go from here to here. And that obviously when you cut through all those muscles, that's very, very painful. And most patients would be in the hospital for about 7 days, not because of the surgery, but because of the narcotic need to control the pain. When we do these operations with the robot, basically the incisions, as I said, are no bigger than the tip of your finger. And when you have those in there, all you're doing is splitting the muscle so that the incisions are not uncomfortable. And most patients can get home within a day.